Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Now, Mariella had written in earlier and said, whenever I try to bring up medication, I feel like I get judged by doctors. What are your thoughts on adding B12 and B6 to his diet? Will this help?
Yeah, I'm really sorry about that. First of all, it's like our life isn't hard enough managing for a child on the spectrum, and then you go to a doctor and they kind of give you a guilt trip where they're like, no, and that's just, you're going to the wrong doctors. So those doctors are the doctors. A lot of Western medicine doctors kind of see autism as a lifelong thing, and they sort of want parents to just get used to it. And that isn't where I come from. So my recommendation to you is, and some children do benefit from the vitamin Bs, 100%, and 12 and 6 are very, very different, but you should definitely transfer over and see a physician, a pediatrician, who is trained in the alternative types of treatment, medical treatments. And these physicians currently can be found on a website called MedMaps. It's an organization called MAPS Doctors, right? And their website is medmaps.org, I think. And if Traven could put that up, that would be great. And yeah, and if you go on this website, you'll find physicians close to you because they kind of list them by state. So, and I would say that kind of doctor, and they can do a bunch of tests and tell you whether or not your child will benefit from B6, B12, and any other supplement as well. So I would really recommend that you do not give up. And there are a lot of really good supplements and homeopathic treatments, as well as just standard medical treatments that are good for our kids and help them a lot.
And I missed before that, and I apologize, Mariella. She said that her child has been doing ABA for about 3 years now. He's 6 years old. He says ba and papa, which is great, and I encourage him, but I wonder if medication can help him focus and encourage speech.
Yes, sometimes medication does help pretty significantly, as you heard from the other parent who was in Indonesia, and they had also done, it's not always just medication. So like medications, there are only a couple of medications that are just, standard meds for autism, but they mostly focus on reducing challenging behavior. But there are medications that treat underlying issues. So for instance, if a child is not sleeping, we can help them sleep with medication. If a child is extremely rigid and has these like unbelievable routines that are very obsessive in nature, then a serotonin reuptake inhibitor type of medication can help. If a child is overwhelmed with sensory stimulation and is very anxious because of that, again, SSRIs might be able to help that. So there are things that help our kids feel better. And then, of course, there's diets. And sometimes our kids have like fungal issues, or they've developed Clostridia or bacterial overgrowths of different types, and all of these things are holding them back from having a clear mind and being able to learn better. So all of those things have to be treated. It's just like you and I. If you go out and you have a food that doesn't treat you well, and you're going to be sick overnight and you don't sleep, and the next day you're going to be kind of out of it and not able to learn. And so we want to make sure that our kids are very, very healthy, very, very stable from a medical perspective, because that helps their brain function better, learn better, and that's what it's all about.
Okay, we got to go. We're out of time, but I just want to say Mariella has written in two things. And the first thing I want to say, Mariella, is that, the phrase, when you've met one person with autism, you've met one person with autism. It's so hard as a parent because you meet other parents and we immediately go, what are they doing? And it's good to ask those questions, but we do have to remember that every single individual is that. Every single child is an individual. And, you referenced somebody who has twin boys with autism, that they didn't take medication. So it feels like you shouldn't either. Let's remember that your child is their own little ecosystem and that things are going to be different for them. I love that you said that he's been off dairy for about 5 months and you started using PECs. She also said, though, that I feel like he wants to speak so much, but the words get stuck. And so are we safe to tell her to look up apraxia to see, is that?
Certainly you can look up apraxia, which is just low muscle tone in the tongue. And there are exercises that a speech pathologist can give you as well. But I also think that, you should be seeing some results when you do things like dietary change. Sometimes those things, and the fact that he started using PECs is great, because sometimes our kids actually, you want to make sure that he has a form of communication, even if it's non-vocal, because otherwise our kids get frustrated. And you don't want them being frustrated. You want them to really be able to communicate.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time on autismnetwork.com. We hope to see you there.